to be part of this and for the opportunity to actually put this update out to a fairly wide audience. And so we'll kick off. The Stage 5 implementation is the focus quite at the moment for the Legislative Reform team within Science and Policy Unit. So as you can see, there's 5 stages. We're now between excuse me, Stage 4 and Stage 5. Stage 5 will be the commencement of all the remaining provisions, which are the environmental health regulations effectively. So that's going to be the main body of work that happens there. There's a few other things that are happening at Stage 5 as well. The date for projected completion has been revised from 2021 to 2022. So we've got an arbitrary date there of 30th of June 2022. So that's what our target is. We've recently met with our legal people who've started to look at the next stage of drafting instructions for what we've essentially finished our consultation process for. And we've been told that's somewhat ambitious, but we're going to work towards that timeframe. Before we talk about the work, I thought it might be an opportunity for you to lay your eyes on faces of some of the people who've been doing the work. This is the most recent people. Some might call them the last people standing in this project because it's been going for quite a long time. We've got Mel Crosby, so she's the Senior Policy Officer working on a number, you can actually see the slides there. So her areas are to do with events, public buildings, air handling and housing. Helen Tanner is working on the wastewater paper, which is currently at the consultation, also going to be turning her mind to recycled water and public health assessments. Zach has been working on the pesticide paper. Sally has been doing the drinking water, offensive trades and aquatic facilities. And Rebecca O'Donnell hasn't been doing legislation per se. She's a recent addition to our team, but she's involved with the public health planning and has been doing some research on public health assessments. There's a grey block at the top of your screen and no photo, and that's because what we don't have is our principal advisor legislation position. Currently, Kelly Crossley, as most of you would know, is on secondment to the Chief Health Officer, and that will be as long as there is a COVID public health response, I suspect. So we do have a new Principal Advisor legislation starting next week, and I'll send out some information about that person when they commence their duties. I want to make sure they come and they start the job before we start announcing who they are and what they do. So far, I think we're just looking at an overview of what the Environmental Health Directorate has been involved in to support Stage 5 implementation. So for each of the interest areas or areas of risk that need to be managed, we've essentially put out, after consultation with an advisory group, we've put out discussion papers, we've drafted those, and there's been a consultation period, usually around 3 months, where people have been writing in their submissions. That's a range of stakeholders, local government and industry and other affected government departments. The consultation summary essentially is prepared based on what feedback we get, but also in consideration of what is happening in other jurisdictions with similar risk-based legislation. Then essentially we propose a point where we're now ready to start preparing the draft regulations or the process for that. So we need a minister's approval to do that. There's a unit within Treasury called the Better Regulation Unit, excuse me, and they are the sort of caretakers of the passage of legislation. They're interested in what the impact of the legislation is likely to have in an economic sense and whether or not it's going to have significant changes. So basically the pros and cons are managed up through that process. They usually ask for a regulatory impact statement as a preliminary investigation of that process, and they may ask that a regulatory impact assessment proceed further down that. So far we've managed to avoid the regulatory impact assessment process, not because we've been clever, but just because we've been quite open about the existing regulations and the proposed regulations and what the changes would be, and they seem to be quite happy with that. Then essentially we're now at that point where we we take the policy instructions, so they're not called drafting instructions until the legal people start working with them. So we call them policy instructions now, as I was reminded last week by one of the lawyers. So the policy instructions are essentially presented to legal and legislative services, and there they start turning them into drafting instructions. There's a whole body of work that happens after this point, but we'll talk about that a little bit later in the presentation. I think we really need to show here that we've been mindful that it's really important when we're going into new territory with regulations that we are doing appropriate consultation and that we've formed key groups. So the Public Health Act reference group was formed at the point of when the Act passed to support the early stages and to ensure the communications during that time was suitable for local government. So that was essentially composed of EHOs from local government. It met for a few times and provided guidance on that process. Then it seemed to break up and there were interest groups depending on which particular area of regulation was being proposed or considered for the regulatory reform. So people with an interest in those areas essentially became our initial advisory group on that, until we got to the point of putting out a discussion paper and then looking at the consultation summary. So then we had the body of information to essentially guide us past that point. So I'm mindful that we've actually consulted with local government, with WALGA, with industry and the government sector. I'm also mindful that that process hasn't finished. So there's been some concern raised in the past and recently by some of the people who've sat on some advisory groups as to why haven't we met? Well, we haven't met because we don't have regulations yet. And also, will we meet again? Yes, we will meet again. And there's going to be a much larger responsibility as we approach the implementation of stage 5. So there's some great opportunities there for those people that haven't been involved so far to participate and also return those people who've had a guidance in that process. Just want to talk about the Public Health Planning Reference Group, which is to do with the local government take-up of public health planning. That group is actually doesn't include EHOs, but it does include WALGA's representation. And that group is more the health department and its ancillary groups who are essentially going to help support local governments to provide the information they need to prepare population health status and diseases of interest and priorities in when they look at public health planning into the future. And I understand we'll talk about a little bit about that at the end, but there have been some local governments already preparing plans and some are holding off. So to land and the sort of range of areas of risk that we, through consultation so far, have identified as best managed through regulation. And they're up on your screen there. So it's important to understand that consultation includes comparison with other jurisdictions in Australia to see what they're doing as well. So essentially I'm going to go through each of these now briefly. It's more of an overview. I'll just touch on some of the changes that are likely to be through there. And also I need to acknowledge that while we've got a raft of them sitting up here with particular areas of interest, it may be that some get clumped together. So we may have water regs, which might have water, wastewater and recycled water, and we might have the built environment if that has to do with housing, lodging houses and public buildings. We've still got to work that one out. That really is going to be guided through by PCO when our legal people approach the Parliamentary Council's office. PCO, my apologies for throwing an acronym in there. So the asbestos regs are current status is they are the only regs that are currently with PCO for drafting. So they're actually already progressed. The reason for that is that we did a revised regulations in 2017, primarily to increase the penalties associated with the old regs. So those regulations still sit under the Health Miscellaneous Provisions Act, and there are new regulations being drafted under the Public Health Act. The view is that they will increase the fines even more, up to 2 to 2.5 times, which brings them more into line with the Public Health Act. And then there was a new addition here talking about using licensed asbestos removalists for quantities over 10 square metres. I don't want to really go down into the nitty-gritty of this. I'm just really trying to provide you with an overview of the process and where it's at. And I'm also relying on the expert people involved in that process to have informed me of those changes in the progress. Aquatic facilities. So the regs adopt the Aquatic Facilities Code of Practice. The certificate of compliance for the construction, alteration and extension of an aquatic facility will remain with the department. A valid certificate of compliance will be a requirement of registration with the local government under new regs. Local government will be the enforcement agency in a similar capacity to the current arrangements. And there will be a similar process to approving a pool to open and provide a permit to operate as currently occurs. Under the new regs, it's anticipated that the Chief Health Officer will provide powers to allow local government authorised officers to conduct a final inspection of an aquatic facility on behalf of the Department of Health where accessibility is an issue. Okay, so I've just had a prompt saying I'm halfway through my presentation. I'm going to run out of time, so I'm going to look more at an upper level view of these.
You can have a little bit more time.
Can I?
Yeah.
Okay. I think the next one is body art and personal services. This one is with legal for policy instructions, so they're now developing that into drafting instructions. The essential difference here is that there will be a category A, category B based on risk, high and low risk activities. The sort of things that are exempted will be the professional industries like GPs, nurses, physios, acupuncturists, registered with APRA. Hospitals will be exempted and hairdressing will be removed. Category A type of services are those type of services where the skin may be penetrated or mucous membrane and might release body fluid or blood. So the sort of things that are being captured in category A: body piercing, flesh tunnelling, scarring, tattoo removal, branding, scarification, and even nail salons and teeth whitening by non-dentists. So the category B services are likely to be more a notifiable process rather than a registration process through local government. And they're the beauty therapy treatments, spray tanning, acupuncture, and other type of things. What the major change here is there's going to be regs that will be developed which essentially talk about penalties for behaviours that risk disease transmission. Things like the reuse of sharps, the failure to wear PPE, the reuse of materials like inks or wax, or failing to do the appropriate training or dirty premises. So it gives a range of risk activities that can be pulled up. The commercial air handling and water systems. So this one has been out for 2 separate periods of consultation, and currently the consultation summary is being finalised. It's near the end here. So I guess the key areas here is the cooling towers and air handling systems. The question is that the feedback we're getting is most of these are in the Perth CBD, most of them in the Perth metropolitan area. They're not really out in the country. There are some facilities like hospitals and aged care facilities that may be affected by these more regionally. But then there's also the query about the expertise in being able to assess this. So I'm not sure at the moment where registration with these will occur, whether it'll be the Department of Health or whether we make a registration with local government. We've got to nut this out, but there's also a audit and sampling process that we can actually impose with independent auditors. So it might be that registration process is not as arduous to enforce or actually monitor. But we will be speaking with local government before we make that decision about that. So still in its very early stages, and we've also got to work out what the department will do in that respect. Drinking water is a great one to get over the line, and one that we thought that we might have some trouble with the Better Regulation Unit, because essentially it's quite a change, because we're introducing a registration scheme where there was none. So this is currently with the policy instructions, and the purpose of it was that it replaces one part of the Act. Part 4, Division 7 of the Health Act, where polluting a water supply is an offence and allows the local government to take action to prevent or stop that water supply that's unfit for human consumption. So currently we work on a MOU with local governments, with licensed water suppliers who are regulated by the ERA under separate legislation. And so the MOU is quite an important feature, because it's part of the process of being registered with the ERA, but essentially that's all it is an MOU. So I think the issue here is that there will be a licensing and or registration, and we've yet to nut that out, process system for drinking water, but the Department of Health will take responsibility for doing that, and also for providing an audit review process of registrants through that process. Now we move to the housing area. So housing is just to do with the public health associated with poor housing. I'm mindful here, this is probably one of the most important areas for regional local governments, because, and also in the city here, because we moving with this, of course, we've got the binding of the Crown issues. So the Crown is bound, housing becomes something that can be identified by local governments and enforced by local governments. So there will be a range of tools for authorised officers, and there will be requirements to prevent overcrowding. I think one thing that Mel wanted to talk about with this one was the temporary building requirements, similar to Section 144 of the Health Act, will be carried over. That's for, oh, sorry, excuse me. There we go. So drinking water. Things like when they're using a shed as a temporary dwelling. The lodging houses is an area that's of interest as to what is a lodging house. So we use the definition. So the definition will be clarified there. The registration with local government will remain. There'll be minimum requirements for laundries, toilets and kitchens. We're remaining consistent, as with housing, with the National Construction Code, and they'll have to actually have a register of lodges for them in future. How are we going with time? Okay. Public buildings. We've separated public buildings and events, just to make that a little clearer. They were sort of lumped together or treated in the past together. So the public building definition will be a Class 6 licensed premises or a Class 9B building, as defined in the Building Code of Australia, where persons may assemble for civic, theatrical, social, political or religious purposes, education, entertainment, recreational, sporting, business purposes, but it excludes childcare centres and any childcare which are subject to childcare services regs. I'm not going to go over the top of that. Events is always an interesting one. And this is managing the public health risks of mass gatherings. I guess the issue we really need to work at here is we met recently with DMIRS, and DMIRS have agreed that they will take responsibility for the structures, for temporary structures associated with events. So how that rolls out for local government of authorising an event, we'll just have to nut that out. But it takes away some of the pain that the EHO bore for authorising the whole event with a structure that they often were not comfortable or confident about being able to assess. Pesticides. This is the last slide here. We're basically completing the policy instructions for this one before handing it over to legal for drafting instructions. We're seeing an increase in the maximum penalty amounts from $2,500 to $10,000, and also the introduction of modified penalties or infringements. which is something that is absent. These were revised fairly recently under the Health Act, but they do need to be revised again, much like asbestos, and move towards air cleans. Hang on. Thank you. That's why I fail at doing morning shows on TVs. Because we're gobbing up great gobs of it. There we go. So this is the use of the products and the use of the labels reiterated there. There's nothing really that's not much is changing a lot more. There's some stuff about buffers and fumigation and that sort of stuff. I think we're going to see some of the regulations and significant changes really need to be dealt with on an individual basis rather than an overview like this. These are the things that are being repealed: hairdressing, morgues, cloth materials, defensive trades, temporary toilets, garden soils. Guidelines for those have been prepared and are currently available on the website. There will be other guidance information as we develop the regulations, and also to support what falls off in the regulations. This is the list of what we still need to do, and we haven't really broached this yet. So wastewater discussion paper is out now, and I think that's of particular interest to EHOs out there in local government land. Recycled water is yet to start, but that will be a component of the water regulations. Nuisance and biting insects was something that was raised as being required, but there's no health legislation specific for that at the moment, so they may not interfere necessarily with the passage of stage 5, but given that some work has already occurred on that, if they did actually develop into regs, there's an opportunity to package them in with the stage 5 regs. And then health local laws seems to be something that is of particular interest at the moment and scratching ahead area. That's not alone for us and local government. So with local laws currently are now made under the Department of Local Government, under the Local Government Act. So basically the Health Department has no role in reviewing local health laws. The intention is that we've sort of left them alone. So we've developed local laws we've transferred over to Department of Local Government. And the concern is that they still hang off current laws sitting under the Health Miscellaneous Provisions Act, so there should be some review by Health for that. And I understand that, I get that, but the standard answer from Health is essentially this is now the responsibility of the Department of Local Government. There are some ways of doing that. There's quite a lot of information on the Department of Local Government website about local laws, and I encourage people who are unaware of that to have a look at that if they're doing that review process before stage 5. And I know there are some local governments, or aware that some local governments have done theirs fairly recently, including Albany, Belmont, Cundon, Gosnells and Manjimup. I think there is something that people need to be mindful with making local laws, or is that if they do introduce them and they are captured by new regulations, or elements or activities or risks are captured by the new regulations, the new regs will essentially prevail over the local laws. So we need to be mindful of that. The other areas of work that need to be worked on in this whole stage 5, public health planning, I mentioned it before. It's great. We're meeting on about a 3 to 6 monthly basis with the consultation team from Area Health Services. Local governments who haven't started their public health planning, if they want access to population health data for their region, they are to make their approach through the Area Health Service, so the population health unit within the Area Health Service that they are in. If you need any advice about that, just flick through some information through to us. Public health reporting is something that is going to grow in importance in the future and really needs to be done properly so that we actually make sure that we are mindful of what level of enforcement and risk management is occurring out there by use of the new public health legislation. Until the regs actually come into effect at stage 5, there's very little to report on at the moment, but we are exploring non-mandatory reporting, so different elements of the Act that we can actually use as an opportunity to guide where we may inform in the future the information. At the end of the day, I think we would like to see a degree of information captured which is provided to us to provide an understanding of what's happening at a state level, but also to feed that information back to local government so that they've got the ability to compare their level of compliance and enforcement activity with adjacent or regional local governments in their area, and also on a statewide average. So that's something that we're mindful of. This is also something that I think that we need to get a advisory group from EHOs about, because we did a recent survey and some of the feedback we got back from that was that there were some questions that could have been better asked. There were some questions that were missing, and there were some questions that didn't need to be in there. So it was a stab out at what we thought was a good capture of a range of the activities, but we realised that more work needs to be done. Public health assessments is still, frustratingly, we still don't understand the level of scope required here. That's likely to be determined fairly shortly, but we're trying to work out what level of activity is going to be captured by public health assessments. That's something that we're going to be involved in, and how we interact with other government departments is going to be particularly important. And then just at the end, there's a review of the Act, and that is what is due 5 years after the Act, but given that is now, we're hardly going to review the Act until we've actually implemented stage 5. So ongoing work for the Science and Policy team.
And that's it.
Thank you. Sorry for the rather accelerated overview at the end, but I essentially got carried away with my timing. So.
All right, so we've got some time for some questions. So we encourage you to type those in. But to start off with, we've had a few questions that have been emailed into us. So Matthew, how long will industry actually have to be able to transition into the new requirements for each regulation? So once stage 5 comes into effect and we have all these regulations come into play on the same day, then does industry automatically have to comply, or will they be given a bit of time to adjust? Yeah,
I'm not sure we can answer that now, but I will. I imagine that when you've got a raft of regs coming through simultaneously, it would make sense that they are staggered as far as as far as the time for uptake. So it depends on how complex they are, what new changes we introduce, if we introduce a registration licensing process, for example. So you're not going to suddenly go from A to B in one day. So I guess that needs to be nutted out, but that would be also well informed by forming the advisory group and getting some feedback as to how hard or difficult that's likely to be to implement, both by us and by local government. So the answer to that is we're not sure, but we'll be guided by the complexity of the process. I think there will be some time after the point in time when drafting instructions reach a point in time where we're pretty happy with the shape of the regulation. And I will be seeking to see if we can start to do dissemination before implementation so that we can actually start to anticipate that type of thing.
And I guess, there's some industries where if licensing or registration was new, that you would give them that transition period, say 6 months or 12 months to be able to submit their registration or their license. So once the regulation comes into effect, they would have that transitional time to comply.
I have a question here.
Okay, Sally's got a question.
You mentioned, from Amanda, you mentioned that WALGA was one of the stakeholders. Are we also including EHA?
Is Environmental Health Australia one of our stakeholders?
They do provide submissions, yeah, but all submissions go to EHA. I guess this is where it gets a little bit confusing, because often the same people are on EHA as well. But it goes to all local government EHOs, which means that it's captured by EHA, and EHA do provide submissions back to consultation process. So yes, in fact, if we don't get one, we go and talk to Vic and say, like, we got one.
And just another question is it possible to have a webinar of some sort to provide an overview of the wastewater discussion paper? So it's acknowledged that the wastewater discussion paper is quite lengthy, and it would be great to have a webinar.
Okay. I'm glad you asked that one, Greg. We've partnered with WALGA to do a webinar on the wastewater paper, which is currently open for feedback. So the 15th of April at 2 p.m, there's a webinar that WALGA essentially are driving. So I'd encourage people to find out about that. So again, 15th of April at 2 p.m, there'll be a webinar on the wastewater paper.
And from my understanding, that's only just been organised, so those in local government should hopefully receive some communications directly from WALGA about that. And once it's organised, we'll also help to promote it as well. And that will be Helen and Natalia going along to give that update.
I've stopped coughing.
Is there any more questions to come in? No? All right. Well, thank you, Matt. I think we'll leave it with, if there's no other questions for Matthew, we'll let him be on his way, considering that's the...
sorry, just one thing that I did want to mention, and I know I'm occupying a bit of time, but I think if this particular presentation as an overview was of any use at all, I think there's an opportunity for an individual webinar on each regulation. I think that might be a staged approach, might be something that people would be interested in. It'd be interesting to get people's feedback about that. So we can actually then have the time and the expert group basically stating what the changes are, going through the changes, indicating what the likely things, the consequences for local government are likely to be. So I really want to gauge whether that is of interest, in which case we could do that on a routine basis, but we'll just pull each regulation up as it currently stands and start to go through what the changes are. So I think that's a reasonable thing to do, but I don't want to suggest something that local government won't like. So yeah.
And I think we also talked about the possibility of reforming the Public Health Act reference group. So this is the group that were particularly helpful in the very early stages of 1 to 3 of implementation of the Act. And it might be useful to get that group back together and talk about the communications that are needed to support local government with stage 5. So we'll talk about all these webinars and so forth.
Yeah, so any type of feedback, and I don't want you to stop listening to Henry's talk, but over the course of Henry's talk, if you feel you have an idea about how you'd like to be better informed about the public health legislation coming your way at some stage in the future, yeah, just let us know. If you've got a better idea, we'll take it on. We're really interested to find out. Yeah,
and you can do that by either emailing the Public Health Act inbox, which is just publichealthact@health, or you can, I'm happy for you to email myself at eh.stakeholderengagement@health.